Hey, it's Dr. Cody Rawl with Stanford Brainstorm. Today we have a Stanford Virtual and Augmented Reality Innovation Lab pitch with Madeline Yip. She's an undergraduate at Stanford that wants to develop an augmented reality experience through Google Glass for patients with autism. All right, so I'm here with Madeline Yip from AnCare. It's a VR for autism, right? Mm-hmm. And so can you tell me a little bit about what your pitch was today and how it went with the Innovation Lab?
Yeah, so AnCare is an augmented reality technology designed to track an autistic individual's response to therapy treatment. I actually learned a lot today at the Brainstorm lab. I definitely really reflected on why autism needs augmented reality. So I will definitely consider these problems and different issues that a user faces in order to center my technology around that.
So what were the practical steps that you can take now in order to make your vision a reality?
I will definitely need to talk with autism centers. I will definitely look out for different people who are interested on my team, getting mentors and other engineers to help develop this technology.
And so what did you find most helpful about the lab today? Was with the feedback, so that you could see blind spots maybe?
Yeah, for sure. I definitely learned a lot of things that I never thought about, for example, intellectual property, and definitely trying not to impose augmented reality onto an issue. So I definitely will think more closely about what I want to get out of this technology and how I can definitely really firm down my proof of concepts.
Awesome. Anything else you can think of that was good about today?
Definitely meeting a lot of different people and just seeing all the great ideas out there. That was really valuable. So I think if anything, I just definitely gained a lot of new contacts, and I really value any possible mentorship.
It was awesome. It was awesome having you here, and I really enjoyed your pitch as well. Best of luck for you moving forward here.
Thank you.
Yep.
Given the level of commitment required for autism therapy, one would expect a systematic way of measuring therapy's effectiveness for each individual. This where AnCare poses a key benefit. It tracks users' moods and anxiety levels throughout the day in order to measure progress in everyday social situations. This patient-centered approach focuses on the users' comfort levels rather than their ability to mimic socially acceptable yet uncomfortable behaviors. In contrast, existing technology for autism uses games and exercises to teach individuals social skills like eye contact. However, BrainPower, right on the screen, is marketed as a personal empowerment product, adopting a rather one-size-fits-all approach. For example, if the user starts to rock back and forth, it would just display an image to kind of distract and soothe the user. In addition, there are a wide variety of apps out there, but often the sheer amount can be impractical to use for the everyday caregiver. Since AnCare is meant to supplement therapy and increase treatment accessibility, AnCare will be marketed actually to therapy centers where they can build a whole database of treatments. So AnCare is actually going to be built on top of Google Glass to create a cohesive user experience and to quietly monitor users' progress in the background, whether it be providing a visual calendar or quietly muting overstimulating environments. The technology is designed to provide comfort and security to the user in any new or unfamiliar environment. If exposed to a particularly stressful situation, the user can remove themselves from that situation by going to their customized safe place. So also, they will practice identifying their moods every hour in order to practice communicating some of their emotions to other people. When I brainstormed potential business models, I considered ANCARE's benefits. Because ANCARE creates a feedback loop between the therapist and the patient. Therapy doesn't have to happen as often and can even be done remotely. I therefore propose a subscription model for ANCARE. Because each person's therapy intensity and duration may vary, it's really important that the caregiver and the therapist actually communicate to decide what is the best therapy options for the patient while looking at some of the data and real-time progress. On average, one therapy session costs about $65 to $150. So assuming that ANCARE can replace about 3 therapy sessions a month, that would bring the cost to around $300. In order to scale, the technology would rely on a referral network of therapists and regional salespeople. In order for ANCARE to go from an idea to reality, these are some of the people we would need in order to develop the technology and to really design the user experience. The overall goal of ANCARE is to allow autistic individuals to go from navigating basic social situations to being able to explore the outside world worry-free. Thank you.
Madeline, I think a lot of the best innovations really come from people who have personal experience, and so thank you for sharing how you were personally moved by this and how this affected your family. It's really interesting. And I guess maybe that'll add into my first question. You mentioned that your brother has been struggling with this. Have you gotten to talk to him about this product and what has his feedback been?
He personally sees a lot of value in it. He's currently in 9th grade right now. He's actually stopped going to therapy when he was around 10, but recently he brought up that he has struggled answering questions, and that's a little bit of a problem for him. So from an outsider, it's kind of hard to see the anxiety that kind of goes behind everyday seemingly normal social interaction. So I really see a value in this technology.
Terrific. Thanks so much for your pitch. I think you were pointing out this is somewhat unique in that the goal of the AR or VR is to have on-demand an ability to calm the person and to center them. Is there any competition? What's the barrier to entry on this?
So I haven't really seen much. There are many virtual reality and augmented reality applications for autism, but the thing is, they're designed for teaching individuals. For example, there's an technology called Autism Glass, which uses games, but those are intended to be used multiple times in a week rather than for a prolonged session. So I think my technology would be very valuable in terms of collecting data and being a fly in the wall and really understanding what's going on with the patient.
And the barrier to entry for the competitors, how is it hard? Why can't they just replicate what you're doing very quickly?
Unfortunately, I think it's actually very easy to replicate. The thing is, they would really need access to a wide variety of therapists and research, because a lot of the concepts that I mentioned in terms of soothing anxiety levels really depend on existing research and what's out there. So currently there's a little bit of a concept, so I want to learn from other individuals about their experience in terms of anxiety and working with autism.
Thanks, Madeline. It's clear that you've really thought carefully about this. Could you maybe speak a little bit about why you think clinicians would want to use this technology, and also a little bit about, the availability of speech therapists in the country? Like, how many of them are there?
So the thing with autism is generally there's a one-to-one caregiver to patient ratio, which means there's a lot of demand for these caregivers. With AIM-Care, this can hopefully reduce the amount of therapy sessions needed for each individual, and this will allow therapists to reach a large network of patients, because some of the sessions can even be done remotely. And sorry, can you, I think there was like a second part to your question?
Do you know how many speech therapists there are in the country, or has sense?
So in places like California or very urban areas, there's definitely a wide variety of resources. I'm not too sure about the number. I did look at like a wide database, and there's probably like 100 in California or more. The thing is, where people live in more remote areas, they won't have access to therapy. So hopefully AIM-Care can help bridge the gap and make therapy much more accessible.
Quick question for you. So you said that the technology could be used to measure moods every hour. So it seems like you're thinking the Google Glass would be worn kind of full time. Is this the expectation that someone would be wearing this pretty much all of their waking hours? And do you see any difficulty with that in terms of feasibility?
The Google Glass can be worn, and mostly when going outside and actually practicing and implementing the exercises taught by their speech therapist. And also it's there to help the users practice identifying their moods, such that they can bridge the transition towards communicating what they're actually feeling with people around them.
We have one audience question.
This is fascinating what we're discussing today in terms of working with the autistic kids or adults for that matter. But I'm thinking that how it could also help the caregiver, in other words, to help them how to use it. It's more like a team effort, because if it's going to reduce the stress for the caregiver, then they are needing to get a lot of coaching and help how to apply it, because the communication between caregiver and the children is the problem, right? It could become a problem, just like any other social situation that autistic kids have, maybe less so because they're familiar, they're, family members and so forth. I'm just wondering if you have given that.
Yeah.
Yes, I was going to say that actually. So I think from what you were saying, the question generally was, how do you incorporate the caregiver into this process, and how might this affect the relationship between the caregiver and the patient who's receiving the treatment?
So I mentioned that AIM-Care would be quietly collecting data in the background. So when the users identifying their moods, this part of the data being collected, like where they are and how the mood could be correlated with the social situation. So the therapist will receive this data, and often will have to communicate with the families in order to say, hey, maybe you should expose your child more to these kinds of situations in order for them to get more practice and be more comfortable in these types of situations.
One last question up there.
Great presentation, because one thing I like is that you actually quantify the potential opportunity in terms of saying that the course of treatment could be about $1 million. And you talked, I think you said that it could cost maybe $300 for therapy or something like that. Any estimate in terms of how much it could possibly reduce spend, either on an individual basis or on a population basis for autism?
Of course, the technology would have to be developed in order to create, to get data behind this. But I think with the ability to effectively monitor and understand how the patient's progressing, this can actually make therapy much more pointed and specific towards the individual. As a result, in the long term, hopefully, therapy can be reduced, and autistic individuals can get the needs that they really need addressed by the correct therapist.
And if you're interacting with a payer, if you can maybe even make a sound hypothesis that you'll be able to produce a better outcome for the same amount of money, for the holy grail, a better outcome for less money, then that's what's going to get a health insurer excited.
Okay, thank you.
Thank you so much.